teen pregnancy and the difficulties that come along with it. Pregnancy is difficult, especially if you're a teenager. According to Robin Weiss, LCEE, teen pregnancy is an ongoing problem in America, and the numbers are growing due to how many girls are getting pregnant as a teenager. I'm here to tell you about all the different difficulties that come along with teen pregnancy. It doesn't just cause physical, mental, or emotional difficulties. It causes all three sides of the health triangle to react, including physical, mental, emotional, and social. Let's look at the physical difficulties. Hormones are a big part of the physical. Estrogen, according to the FDA, can cause swollen feet and legs, rapid weight gain, breast pain, increases breast size. It leaves blood-filled skin sores, confusion, feeling of illness, joint or muscle aches, persistent nausea and vomiting, pains in the stomach, sores on the body, tiredness, and yellow eyes and skin. HCG is another hormone included in pregnancy, and that can cause nausea and vomiting. HPL, it'll make you lactate and helps out when you want to nurse your baby. Another very common physical problem with teen pregnancy is pain. Braxton Hicks are contractions that are fake, and they go from your back all the way around to the front of your stomach. They feel like real contractions, but they're just there for practice, pretty much to tease you until the real day comes. Leg cramps are common due to the extra weight that you gain at the top of your body. Your legs lock and cramp up, and that's very uncomfortable, especially when you're a teenage girl and you have such a small structure and your body's not big enough to be able to carry the weight around. Leg cramps happen. Your lower back pain will also occur due to the weight. If you have a lot of weight on your stomach, it's going to cause your lower back to ache up and make you really uncomfortable. Abdominal pain, well, of course that's going to happen. You have a baby in your stomach. It can happen from gas, Braxton Hicks, cramping, just any problem. Maybe the baby kicks too hard. Abdominal pain is a big issue in teen pregnancy. You can also get pains in your feet and legs. If your body holds too much salt because you eat too much salt during your pregnancy, like most teenagers like to do, they like to snack on all the unhealthy stuff, then your legs will swell and it'll make you very uncomfortable. Another physical thing that a lot of teenagers don't think about is the delivery of the baby. What a scary thing. There are 3 different steps to delivery. During the first stage is the Latin phase. The cervix effaces and dilates 3 to 5 centimeters. Your contractions are usually 10 to 15 minutes apart, and it's not really that uncomfortable, but it's just the first thing that'll happen. Then part of the first stage is the active phase. The cervix will dilate 7 to 8 centimeters. Contractions increase in the length of 45 to 75 seconds, and this phase usually lasts 2 to 3 hours. The transition phase, you dilate 8 to 10 centimeters. Length of contractions are 1 to 2 minutes, usually lasts an hour to an hour and a half. That is a very uncomfortable phase. That is when they will give you the epidural, when your contractions will get really bad, and it just puts you in pretty much unbearable pain that you never thought you'd ever experience. The second stage, the cervix change, where the baby is born and the mommy does all the hard pushing. Pushing really hurts and can blow blood vessels in your face and all over your body. It's a really tough thing on a teenage girl. Your bodies are not made to be doing all that work yet. The third stage and the final stage is the cervical change, and that's the delivery of the placenta. It's not a very pretty sight, and it's actually pretty gruesome. It's not something you want to experience as a teenager. Another part of the physical aspects of pregnancy is weight gain. According to the Cleveland Medical Center, you should gain 25 to 35 pounds during pregnancy. The weight gain goes like this. The baby weighs around 8 pounds. The placenta weighs 2 to 3 pounds. Amniotic fluid weighs 2 to 3 pounds. Breast tissue weighs 2 to 3 pounds. Blood supply, your blood kind of doubles up, so that weighs 4 pounds. Your fat stores get bigger because you need to be able to nourish the baby that you're holding, and that's 5 to 9 pounds. And your uterus increases by 2 to 5 pounds. Another part of teen pregnancy, which is no fun, that I have experienced, is stretch marks. When your body goes from being small to being big in a 9-month span, you tend to stretch. Your skin cannot hold on, it's not elastic like you think it was, and you get nice little lines all down your stomach. Well, when bikini season comes around, guess what? You're not going to be wearing one. Lactation is another very embarrassing physical thing that happens, and if you're a teenager, it's that much more embarrassing. You know, you're walking through the grocery store, a baby in the next aisle cries. Well, guess what? Your boobs are going to send and they're going to lactate. Whether you like it or not, breastfeeding or not, you're going to lactate, and it's going to cause big, huge wet spots on both sides of your shirt, which, you know, you're not going to be able to talk to anybody or pick up any guy at the grocery store with that happening. So, you know, it's just getting pregnant as a teenager can really physically hurt your body. But now that we've talked about the physical stuff, why don't we go to mental? Because sometimes the mental pains that happen during pregnancy are by far worse pains than the physical. Estrogen, also the hormone that is used in the physical stuff, can cause confusion, mental depression, and unusual tiredness. You know, when you got to get up and go to school, you got to do after-school sports, unusual tiredness and depression is not something you want to deal with. Not at all. Anxiety is another mental aspect of teen pregnancy. You know, you're worrying about all the extra weight you're gaining, you're worrying about recovery, maybe you had a really rough delivery. You're worried about family members because they don't agree with the fact that you got pregnant. You know, they're putting a lot of pressure on your shoulders, especially if you're worried about your relationship. Let's say that your baby's dad is not any longer in the picture. He doesn't want to be in the picture. He's a teenage boy. He wants to go out and live his life. That causes a lot of mental anxiety on a pregnant teenager. And it's just not fair for any girl to have to deal with that. You can also get very lonely. When you get pregnant, you don't have time for your friends, you don't have time to go out and socialize. That causes loneliness. You sit at home with your baby. You know, whether you have a baby or not, it just causes a lot of issues. Heartache. You know, let's say that you have the baby. The dad walks out of the picture. That's heartache. And most teenage guys are going to do that to you. Whether you think that you're getting pregnant because you want them to stick around, that's not going to matter to them because their minds are elsewhere. Also, let's say the baby's premature, is having problems in the hospital. That will cause a lot of heartache on a mother. Your brain is not, it's just not big enough to be able to deal with all that. It's a lot of pressure on a teenager. Also, we're going to look at the other side of the triangle, social. You know, everybody's like, well, social doesn't matter. Well, if you don't have a social life, your life's pretty much going to be miserable. You know, think about having to go back to school. How are you going to make up the time that you were out while you were pregnant? You're not. It's hard. You're going to have to go to alternative school, maybe get a GED. Going back to school is going to be really hard. And then you got to think about working full-time because you have to provide daycare while you're at school. It's just, you know, it's not a good thing. You know, your friends, they might not come around as much. You know, most teenage girls are not going to want to sit at home with you and your baby and hang out on a Friday night. They're going to want to go out and party and do normal teenage things. You know, your social life is just pretty much going to be wrecked. Relationships, you know, if you're in a relationship and it goes south, it's going to hurt you. That affects your social life. You know, of course the dad can go out and get a social life, but you have a baby to take care of, so you're going to be the one who's stuck at home while he's out partying. And you're not going to want to break up with him because of course you're going to want the dad in the picture. So you're going to sit there night after night and fight and argue and cry and try to make it work, and it's just not going to because boys will be boys. You know, your family, they are not going to want to come around maybe. You know, not always this doesn't happen, but they might disagree with your decisions and your actions, give you a lot of grief about it. You know, it's hard to be a mom and live at home and have another mom raising you. It's just not how it works. You know, you're trying to do what's best for your baby, but then your mom's telling you what to do, and you can't tell her no because you're still a teenager. It brings a lot of hard pain on everybody. You know, your free time, you're not going to be able to go out and party. You're going to have to, if you want to do that, you're going to have to find a babysitter. You're going to have to get a job and find money to pay a babysitter. You know, maybe relatives will be nice and let you go out every once in a while, but let's face it, grandparents are not going to want you to drop the child on them at any given second when you want to run out the door. It's going to make you look really irresponsible. So pretty much your social life, if you get pregnant as a teenager, it's wrecked. You can just cross that right off the list. Teen pregnancy, as you can see, is really not that easy. I'm a teen mom. This is the story of my life. I did have my son Jace at 16. If I could take it back and do it 6 years from now and still have the same child, I would. If I could take it back and not have him, I wouldn't. But that's no excuse. You know, you can prevent it from happening. You don't need to be put through all these hardships. You can wait, you know, 6 years. Just give it some time. Make sure you're with the right person. Use protection. You need to understand that it is difficult to be a teen mom. You know, think before you act. It's hard work. I mean, if you find it worth it, then it's worth it. But it is very difficult along the way, and I want you to be aware of that. Thank you.